whenever we search CAPF or any interview like thing on YouTube, the only thing we get is PD classes.
Thank you.
So the only person who actually helps students in interviewing in their personality development is you, sir. The PD classes only helps in all of this. So I was actually like wanting to be with you, to be the part of PD classes. I was sure that I will get to learn a lot of things from you. PD classes is just a blessing for all the medical aspirants who are preparing for CAPF.
Okay.
Without you, I think this matlab, people just think of we'll watch some videos on YouTube and everything and we'll be able to crack this exam, but I don't think so. Without a proper guidance, it is very difficult, and that proper guidance we get it from you.
Thank you, doctor. So first of all, I want to know from you, doctor, why do you want to join CAPF?
Sir, see, actually, first before joining CAPF, I am a doctor. So being a doctor, I want to serve humanity.
Right.
I want to treat people. I want to give the best treatment I could give any person. My brother is in Indian Navy, and once he got injured, so he like somehow he didn't get good treatment there. So after that, I decided that when my aim is to give treatment to people, so why not give it to our people, our heroes of our society, of our country, who give protection to us, who make who make our life easy, livable in this country, who are actually giving protection to our borders. So this is the reason why I want to CAPF, want to give treatment, the best treatment possible to our heroes.
Right. You have done your MBBS from which college?
Sir, I've done my MBBS from GS Medical College, Hapur. It is a private college.
And how many percentage you scored in your MBBS?
Sir, I got 68% aggregate.
Very good. Tell about your hobbies, doctor.
Sir, firstly, I am very fond of music. I like to play instruments. I like to sing. And I like to travel. I like to meet new people. I'm a very extrovert person. I like to know other people, their behavior, their psychological behavior they portray. And yes, sir, I like to travel.
Where you have traveled yet?
So recently I went to Goa.
Okay.
My brother was posted there, so I visited to him.
Which post your brother is in?
Sir, he is a lieutenant commander in Indian Navy.
How many commands are there in Navy? You know?
Sir, I'm
There are
sorry.
3 commands in Navy. Okay. Okay, you are coming in CAPF. What do you know about CAPF?
Sir, honestly speaking, before this, I had very little idea of CAPF. But after when I filled this form, I actually Googled it and researched like a bit of it, but whatever I could do. So basically, I know this is Central Armed Police Force, and we have some subdivisions. Like we are where people like ACs are posted, MOSBs and ACs are posted, CISF, BSF, CRPF, ITBP. Basically, these are the borders where people are posted, soldiers are posted, and there we give like ACs, assistant commandants give their like they perform their duty of protecting our borders, and as doctors, our duty is to treat those soldiers.
Okay. So you have completed your interns in the year?
So I've completed my internship in May 2023, and after that, I am working as a non-PGJR in a government medical college in Meerut.
Okay. So what is the work profile of a medical officer according to you?
Sir, the work profile of medical officer needs a lot of perseverance as a leader, because we'll be given one like I think a division or a command, and we have to take care of that, supervise it. Our subordinates should work properly. This is our duty to ensure every soldier and their family members should get good treatment, best possible treatment. And yeah, as a leader, they should work. Sir, you're mute.
Tell me the total doses of vitamin A
Total doses of vitamin A.
in international units.
Total doses are given, I think. Uh, I read. I
Okay,
think
go
it's
through
five.
it. Tell me the composition of reduced osmolarity ORS.
Yes, sir. Reduced osmolarity ORS. It's glucose, um, sodium, potassium, magnesium,
Sodium,
zinc.
this glucose is how much in millimole per liter?
That is 315 millimole per liter. The total reduced osmolarity is 375 millimole per liter. So in that, glucose is 135.
Okay, doctor, total is 245 and sodium is 75 millimole, chloride is
Oh,
65, glucose is 75, potassium 20, and trisodium, that is citrate, or 10 millimole per liter.
okay.
Okay, tell me about diastolic murmur.
Like, where do we find that?
Yes, whatever you want to speak on diastolic murmur, you can.
Diastolic murmur. So diastolic murmur will occur when the heart is in state of relaxation,
Okay.
and we'll get diastolic murmur in a, uh, aortic regurgitation.
Okay, tell me about the types of insulin.
Types of insulin is one. It is regular insulin is used.
Yes, regular, that is short acting.
Yeah, Lispro is one insulin,
Rapid acting, intermediate,
and
long
long
lasting,
acting,
ultra long lasting.
ultra long lasting. Yes, sir.
Okay. Okay, now you tell me about DOTS, DOTS.
Okay, DOTS is a treatment for tuberculosis, and so there we used HRZD. HRZD is rifampicin, isoniazid, ethambutol, rifampicin, and streptomycin. So this is for one is the one is the maintenance phase, loading phase, and one is the continuation phase. So loading phase is for 4 months, and continuation is phase is for 2 months.
Okay. Now, doctor, my next question from you is name the mosquitoes, only the names with their diseases.
Sir, Culex, Culex, Japanese encephalitis is caused by Culex,
Okay.
and Aedes, dengue, malaria, chikungunya, all of these are caused by Aedes aegypti, and Anopheles mosquito, and sandfly,
Okay.
leishmaniasis, kala-azar.
Okay.
That's it, sir.
Okay, doctor. Now you tell me about uh, types of beriberi.
There is wet beriberi and dry
Right.
beriberi.
Tell me the difference between both of them.
Sir, wet beriberi, it is in alcoholic
It
people.
shows brain issues, and dry one
Yeah,
shows
brain.
CVS issues.
Okay.
Okay. Okay, name the different types of dialysis procedures.
I have no idea what
You
this. I
know
have to
Dr.
read on.
Hemodialysis and peritoneal.
Yes. Oh, yes. Yes.
What are your
Yes.
strong points, your strengths?
Um, so as I'm currently working in neurosurgery, so look, I was just thinking that I could give this as my strength, but then I thought ki, brain is such a huge part, and I think I should not tell this thing that neuro is my strong part because they can go into depths where I can
Okay.
be stuck.
Definitely, neurosurgery is a vast topic. When you said about it, I started searching good questions for you. Okay, then what favorite you are going to speak? You tell me.
So I think micro I like as a subject,
Okay.
and surgery as well, I can say.
Surgery, they would ask you, okay, what is PUD orange?
Sir, that is breast carcinoma.
Do you know the
That
management
we
of?
see
Yes, you are right. Tell me the third stage of labor. Do you know its management?
acute management third stage of labor. Sir, we give oxytocin
Definitely, there is
and
a complete management. Like the question is active management.
active management of third stage of labor.
Okay. Okay, if surgery is your favorite, then tell me the management of cholelithiasis.
Sir, cholelithiasis is the mainstay treatment is cholecystectomy.
Okay. And what are the causes of cholelithiasis, doctor?
Sir, cholelithiasis. Cholelithiasis causes can be multiple. Like there can be stones which are cholesterol stones.
Okay. Okay, doctor. Now my next question to you is, uh, tell about varicose veins.
Okay, varicose veins. Sir, varicose veins are basically the tortuous veins in the limbs. The
Okay.
protruded tortuous veins in the limbs, and they mainly occur. So basically, the perforating membrane between the short saphenous vein and the great saphenous vein that gets obliterated, due to which there is the tortuous veins that develop in limbs.
Okay.
This mainly happen in people who have a long standing
Right,
cases.
right, right. Okay, doctor. Now you tell me something about your college life.
Sir, initially when I entered college, actually I prepared well for my UG, but due to some personal family issues, I couldn't get into a government college. And then somehow, like family's pressure, also I had to take up private, which was not easy for my family to afford. But they insisted me on to take this. So when in first year I entered college, I was a total nerd, and I used to like study all the time and everything. uh, my main aim was to get a distinction which was 75% above, but unfortunately, I could get only 74.2. So that made me really disappointed. And then like, I was very disheartened, and I had this feeling of giving up. And then, eventually, I just stopped reading, and I got into a little, when you get into college, then you find new friends,
Right.
you find new people. So I got into all this, but fortunately I don't have any supply, and I was able to get a decent 65% above in every prof in all of my first attempts. So sir, my college life was in all good, and I was a face of every cultural event of my college. I used to be an anchor that time. I love anchoring, and so I enjoyed, I studied, I saw multiple cases, treated many patients, met new people, new cases, and played basketball, cricket.
Okay. One of our student is in interview chamber right now. He is just entering.
Okay, sir.
CAPF.
Okay.
So just now I messaged, so you might have seen also. I asked him that your interview is over or not. He said, sir, after lunch. And now I asked, he told me, sir, they are asking mixed and few like topics, medical topics, you know very well, there are abundant. I'll tell you, don't worry.
Hmm.
He has sent the questions from whatever asked from the other people, not him. And no, sir, yet to be done means his interview is yet to be. It is 3
Yeah.
p.m. Definitely after that. And
Okay.
he is our well-wisher, good student. He will definitely respond so that our further students will get benefited. I
Okay.
think he will be giving his interview soon. And regarding medical topics, I'll give it to you. Whatever he asks from the students and all this, whomsoever are there. What is your weakness?
Sir, I think I am a little emotional person. That is the biggest weakness I feel about myself. I get attached to people pretty easily, and then I don't see things practically much.
Okay, doctor. Doctor, I have written all your loopholes here. Okay. How
Okay.
are you feeling? कैसा लगा आपको with us?
Sir, whenever we search CAPF or any interview like thing on YouTube, the only thing we get is PD classes.
Thank you.
So the only person who actually helps students in interviewing in their personality development is you, sir. The PD classes only helps in all of this. So I was actually like wanting to be with you to be the part of PD classes. I was sure that I will get to learn lot of things from you